Good afternoon. I'm Dr. Lawrence Schachner, and I'm Chair Emeritus and Professor Emeritus of Pediatric Dermatology at the University of Miami School of Medicine, where I chaired the Department of Dermatology, but served in both departments. I've been the chair and the director of the Masters of Pediatric Dermatology for 31 years. So it's been very exciting to not only sustain it, but grow it and bring in a whole new generation of outstanding lecturers in the field of pediatric dermatology.
So can you share your top pearls for early and accurate recognition of atopic dermatitis in infants?
So we can make the diagnosis of atopic dermatitis very complicated, or we can make it very simple. And simply put, if it's a child that comes from a family with a history of atopic disease, skin, reactive airway disease, gut sensitivity, etc., that's number one. Number two, if the child's really itchy, that helps. Three, babies and infants tend to have atopic dermatitis in a classical extensor, this part of the body, as opposed to that part of the body, which they'll grow into at 2, 3, 4 years of age. So you make an itchy kid with the typical morphology, typical distribution, and family history with a recurrent process, and we have a diagnosis.
What gaps do you feel persist in the diagnosis and assessment of atopic dermatitis in infants, particularly skin of color?
So I think it's very important that we acknowledge that there is an access issue. People who have richly pigmented skin may not have access to a live pediatric dermatologist and may not have access to telederm. There are some states in the United States that don't have any pediatric dermatologists, and certainly the indigent and less wealthy populations within those areas are not going to have access, and that creates a gap.